as a clinical pharmacist, job roles in hospitals and so on. So it's nice to see that our clinical pharmacists, the roles in hospital are growing up. And back, in Tamil Nadu, back in 2022, when I was doing my internship, uh, I used to see like in hospitals, we do have a separate clinical pharmacist department. For example, in Prashant Super Specialty Hospital, where I did my gastroenterology as one of my specialty, and then also in Gleneagles Global Health City, in Chennai, neurology department, we do have some clinical pharmacists who is working in there, right? Yes, so it's good that opportunities for us as a clinical pharmacist been developing and booming now. So, what's your take on that? Like, how many of them in who has joined this meeting, like conference, are working as a clinical pharmacist? Could I know, please?
Sorry, audio is bit lagging.
Okay, could you hear me now?
Yes, sir.
Yes, the question I asked was how many of them in this meeting like are working as a clinical pharmacist? Would anyone give a shout out?
I think most of us are students, sir.
Students. Okay, that's grand. And I think it's a right stage. You are in a stage like what I'm going to do next. Like yes, as we have so many options. First thing we choose like going on into a industry rather than what we study. Like all of 6 years, 6 years, what we did dedicate completely is for patient care, patient-centric care, um, helping them to get a right medicine at the right time and right dose. So that's our three magical things, what we do for the patients. Um, that's the only thing we work for and we strive for all 6 years, right? So in that mean, we dedicate our complete studies of 6 years for patient care. But at the same time, our secondary roles will be on clinical research associate, clinical research organization, clinical trials, so drug inspector and those kind of things. And but our first and foremost is clinical pharmacist to help patients, like to help like in terms to improve quality of life of a patient, right? Yes,
Yes, sir.
yeah. And that means, back in I started my PharmD back in 2016, and in 2022 I completed PharmD. And in meantime, like I would say in fifth year and sixth year, during that time we planned, back with my family and me myself, like we planned that we should do something for patients, like and as you know, in India we are a huge populated country, and so many patients with prescriptions, and so many of them are being prescribed with over prescriptions, like polypharmacy, to be exactly, to use the term polypharmacy, right? So what we thought is like, okay, fine. Now, so many of them are having prescriptions now, without knowing so many of them are, so many people in India have been prescribed with various drugs and polypharmacy. Then that will lead to more drug-drug interaction or drug-food interaction. And even in the previous session, Dr. Praveen, he talked about like anticholinergic effects. Um, yes, so we do have so many drug-drug interaction and drug-food interaction. Without knowing this, like people or patients have been taking the tablets, like uh, I mean outpatients. So what we thought, okay, fine. As a clinical pharmacist, what we do in internship, the services, right? Patient chart, treatment chart, review, drug interactions, and all those things, right? And patient counseling. We thought, okay, fine. We are doing for inpatients. Why can't the same thing we do for outpatients? So that's our idea behind this. So what is your take on this? What is your thought? Could anyone answer to this? Uh, just your general
Sir,
viewpoint on.
Sir, can I get a question again, sir? I am not getting.
Yeah, so I was like, what do you think about the service? Like, okay, uh, as a clinical pharmacist in hospital, so we do several roles, right? Patient chart, review, and patient counseling, drug interaction, and finding intervention. What do you think the same role we are doing for outpatients? What do you think it will happen if you are doing for outpatients, as I do, like in a medication opinion center? Do you think that will make a huge impact or change in patient's life?
I think, sir, it will impact on patient's life.
Yes, that's a point. So that's the point. That's a kind of umbrella term, right? We can include so many things under that. Yes, it will eventually bring an outcome in patient's life, right? Yeah, as I said before, there are so many patients, like so many people who who just take OTC medicine, and also like they have different doctors. Like for example, they go for hypertension for one specific GP, and for diabetes they go another GP, and so they have two different altogether like prescriptions, and they have two different doctors, and sometimes patient might not take the previous prescriptions, and tell all those things to the other doctor, and there's a huge gap between that. Uh, did you get me right?
Yes, sir.
Yes, sir.
So now we have that huge gap in between those things. Like now, so that's what we thought. Okay, fine. Now we identified this gap, and we are just going to fill that gap and fill the bridge between those things. So each and every patient should take this sort of, like whole medical record. For example, if they are going for different treatments for different doctors, they need to take all their medical records and go on approach to the next doctor. So that's where the present doctor who is seeing his prescription or medication chart, he will know like, okay, he's having these condition medication history, and we need to prescribe accordingly. So that's what. But at the moment, I think this particular thing has been lacking, isn't it?
Yes, sir.
Yeah. So that was a overall thought process regarding starting this particular medication opinion center. Okay. Uh, so we are just like creating our own opportunities, as we all studying pharmacy and doctor of pharmacy. So what is doctor? Like we can't just put just a suffix, like a prefix as doctor. So if you are putting that, you need to work for it. You need to earn that prefix, as a doctor. So that's what we thought. Okay, fine. What we can do for patient and patient outcome and patient, you know, to improve patient quality of life. So that's the one we thought behind this, and now we need to do that service what we learn, like 6 years throughout the things. Like we learn so many things about medication, starting from our first year, starting from human anatomy, and then ending with like in fifth year we go through so many things like biopharmaceutics and pharmacokinetics. So we study a lot, right? In graphs, and I think most of the students will be in fourth year or fifth year, and I have gone through like how many graphs we put in, how many records we write, like you know everything is patient centered, right? Yes.
Yes, sir.
Yes. So we just need to like um, integrate those things, like what we study we need to apply. So application is the final process. So we are I'm not saying something wrong about that thing, but what we study we need to apply, like so our role as pharmacist, as a clinical pharmacist, it plays a vital role for the society and for patients especially, like and the services what we provide, it is definitely going to help the patients, starting from whatever role, like medication chart review, or you know so many things what we do in internships. So the thing is, we need to use that things in a proper way. So that's what we thought. Okay, we just started this after 2022. We just started in the month of August, Dr. Manoj Medication Opinion Center, and we launched the this center. And at present, we are in Chennai, Tamil Nadu, and we are just planning. Okay, fine. Now to get more and more doctors, like doctor of pharmacy, to involve in this field. So we are just creating our own opportunity. So as per law or whatever things, like we have that thing. We are not, and at the same time, we are just abiding to the law. Pharmacy Council of India. So like we do not prescribe drugs. We can prescribe, but for that too, it's in the process, I think. So like only for few ailments, and fine. We are not doing that too in this particular center. So what we do is that we are just going to view patients' prescription, and if anything is going wrong in the prescription, we are just going to analyze and give the report. The same thing what we do in hospital as an intern, the same services we are doing it for outpatients. We're not going to prescribe any drug, and nothing related to what a doctor will do. Like none of that. We are not going to diagnose or prescribe anything. We are helping the patient's life, so not to end up in any adverse effects of the drug-drug interaction or drug-food interactions or whatever things, like even drug-drug interactions. Like that makes a huge difference. Like if you identify those kind of intervention, right, and if the patient is taking right uh, drugs according to his condition, whether it is according to the guideline or whether he's overdose or underdose, everything we can find with that drug in that particular prescription by collecting all those patient's medicine or medication record. So that's what we do in hospital. So that was our plan eventually. We started, and now it's 3 years old. We have all the things, like it is under government incorporation, and everything has been done. And now we are expecting more and more pharmacists, clinical pharmacists or pharmacy doctors, like they need to take over this, and they're just planning to get them into action. Yeah. So what do you all think about this, like about this concept?
Sir, it is necessary because I have experienced relating to antibiotics
Okay.
inpatient case of inpatient for some skin infection.
Hmm.
The doctor has given antibiotic as empirical amoxicillin,
Yeah.
and same the doctor continued for about 3 weeks,
Hmm.
so that he was considering it as an a mild infection.
Hmm.
And then later after, this infection had grown so vast that
Hmm.
that total area is blackish.
Yeah. Yeah. So those kind of things, like yes, we can report these things, and also like we create our own report, like doing these things, and end of the day see how vital it will be, like for a patient, like Anand. It's a very good thing which we can note it down. And also during our internship, we have this pharmacovigilance, right? Pharmacovigilance. Here we have the sheet, and we can, that yellow form, we can fill that and maintain a record, right? Adverse effects, adverse drug
Uh,
effects, or adverse drug events.
and second, I came across some brand related that adverse side
Mm-hmm.
effects, brand
Mm-hmm.
related. In some brands showing that particular ADR, and some brand not showing. That's why the patient was asking for that previous one. So, but doctor was writing that particular one. So here's the role.
So yeah, so our role plays a vital key factor, the key factor in these kind of things. Either it may be in hospital or in a private private center like us. So that was the plan, plan in the sense we need to act as a service. So that's why we just started this center, and now we expect like more and more family doctors to be a part of this, and lead forward instead of so government will do their work. Like we don't need to like go and interfere with that for some, yeah, okay, we can tell our queries, okay, fine, we need this job, and we can just give our statements, okay, fine, we can just leave it to them. But at the same time, we need to work on ourselves to what we can do that, what we can do to uh, promote ourselves, promote ourselves into public. So for example, like you can just see like how many of them know like we exist in public, like as a role of pharmacy. No one knows, like, and only few knows what doctor of pharmacy actually does. So we need to promote ourselves, like so that's what right now. Uh, how many? Just think of like you came up, Anand. You came up with your own example. So each patient or each family and each like we have around 75 people here, like including me, like each family will have this story, like same kind of thing issue in one of the other. So if you change one particular patient, like thi- just think about it, how many patients or people life you're going to change, and that's the satisfaction what we get, at the end of the day, to put a smile on the patient's face, right? So you can't get that anywhere, right? So that's what we are trained for. Is it? Am I right?
Yes, sir. Yes, sir.
Yes, Anand. So that that was our whole idea. Like, yeah, yes, I do see like as one part from RX doctors and so many organizations like Pharmacy Association, and they are just taking steps to, okay, we do exist, and approaching governments to increase job opportunities. Okay, we are doing that. That's fine. At the same time, we need to do like what we can do on our own. Like, so that's what we thought. Okay, fine, that can happen. When it's going to happen, that will definitely going to happen. Like as I said in the start, government are very much like implementing these kind of things in government and also private hospitals. So both of them, they are very much like interested to implement these kind of roles in hospital. And even like I would say you will be very surprised in Tamil Nadu. There's a government hospital, like there's a huge government hospital, multi-specialty hospital. When I went there, and I just said my I do PharmD, and they recognized me, like they know, they knew me, like, and I was quite surprised. And I said, and they knew, and everybody recognized me. PharmD plays a good role and vital, and they also offered me like uh, a clinical pharmacist role there to work as an intern. But unfortunately, I didn't have much time to get that permission within my completion of degree. So for that reason, I couldn't able to do internship. But I could say government are being recognized our role. At the same time, yeah, in 5 or 10 years, or maybe maximum 5 years, uh, our role will be in almost every hospital, one or two, or maybe more than that, both in private and government. At the same time, simultaneously, we need to work on ourselves, like what we can do, like in per person. But so that's what we thought. Okay, fine, the same thing. We, if not now, never. Like that. That's what we took a risk. It has a risk factor, not like we invested so many, like invested amount, like we need to for starting from logo or whatever thing, like government incorporation. We invested in my parents, and they helped me in this. And yes, they took a risk, and I took a risk, to get a. I would have easily ended up in a job, right? Okay, as a clinical pharmacist in hospital, or you know, CRO or CRA. There were so many opportunities for me. Even I in JSS College of Pharmacy, like um, we had some interviews too, campus interviews, and I didn't opt for that. Why? The reason behind that was I was working on this to my own company, so to get a startup. So I had immense amount of confidence in that. So it was a baby, like, at the start it was a baby. Now it's 3 years old. Now I can see the improvement in people, and we gave a lot of like advertisements and marketing for this particular thing, marketing in the sense in a good way as a service, and people are very much interested in it, and they are very much interested, and they wanted, and they say their own stories, like Anand, what you said. They gave their own stories, and they came up with their own family histories and what they had. To whomever we just pitched this topic, and everyone coming with their um, own kind of things what they had in their family, and if it is going to uh, come into action, like already it has been in action. At the same time, we just stopped for a while, as I came for my came abroad for doing study. So for that reason we just stopped that for a while as of now. But it will definitely function back, and still we are in the back end, we are still advertising, and all those things are going on. That's where I got this feedback in the sense from all the companies, or even from doctors and general public, and we got good response. And they just want, and they still know we maintain the records of medical records of patients, and abiding to the laws again, and all those things we do, like, yes, and people want this, and that's what they said. It's quite new, you know, medication opinion center, and Dr. Manoj Medication Opinion Center. It's very. They say it's very welcoming, and people are welcoming, and they definitely need that, and need of the hour too. So that's my whole thing. Like, what is this behind? Like, we are just going to bridge the gap between a doctor and a clinical pharmacist and patients. So that's the kind of triangle thing what we are going to do. So we're just bridging the gap. And again, I say, like, we don't diagnose or prescribe. We just do what we do, like what we trained. What we trained, we are just going to apply. That's the thing. Same thing what we did for inpatient, we are applying for outpatient. That's the only idea behind this. Nothing else right here. End of the day, it is going to improve patients' quality of life, and that's the end motive. Yes, I think it's open to questions. Do anyone have any questions? Please feel free to ask. Like, hello.
Yes, sir.
Yeah. Now I think. Does anyone have any questions? And they can ask me. Yes, Miss Aishri, I'm open to questions now.
Yes, sir. If they have any question, they can write in the chat box. I think there are no questions.
Okay, so I'll ask. Okay, what is your take on this? Like, could anyone come up with an answer? Like, what is your take on this medication opinion center?
I think it was absolutely necessary and a very good initiative from your side, sir, because our job is to improve our patient's life, the quality of life and everything. And the more the patient will feel connected, they will feel like more comfortable to come up with their problems, and they'll understand more about their diagnosis or treatment. So it is our job as a clinical pharmacist is to be a bridge between physician and the patient.
Yeah,
So this initiative from your side, I think it's a wonderful initiative.
yeah. So thanks very much,
Uh,
Aishri, support. Yeah.
Sir,
Yes, Anand.
sir, most of times what happens? Patient goes to multiple physicians, but don't convey the second one or first one.
Yes,
And
absolutely.
secondly, also I have encountered some of herbal treatments taking for some skin infections and
Yeah.
overactive bladders. Yes. Uh,
Mm.
so this can be addressed via this opinion centers.
Definitely, yes. That's what. Yeah. Yes,
Sir,
Pradeep.
this will definitely uh, good approach. Yes, sir. Definitely.
Thanks, Anand. Thanks very much. Pradeep. Yeah. Okay.
Pradeep, you are unmuted. So if you have, yeah, an opinion to share, please feel free to do so. If not, please mute your mic.
Oh yes. So yes, guys. That's the story behind this, and we just want to make sure we are utilizing our training. For 6 years. 6 years is not a you know it's like we invested almost like 5 to 6 years of our life in that, and we need to properly use that and for serving the patients. So that was our only motive, and and eventually we as you are the future, of the center, especially, either you may work in clinical hospital or whatever your interest like, and there are so many doctors like doctor of pharmacy have been graduating each year, and whoever has interest in this, like, in Dr. Manoj's Medication Opinion Center, it's like they're definitely open for you, and also, like, at the same time we plan to expand this to, like, uh, like, yeah, it will definitely be an end of the day. We all need job, right? And we are hoping that it will create a job opportunity too. Yeah. So that's the thing. And only thing to finally, what I like to say is, like, the center has been the only motive and theme is, like, improve patient quality of life, to use safer medicine, like, and we care for your medicine. So that's our tagline to, like, yeah, we care for medicine, and we, in the sense, we, like, as from the graduates. So I don't say I, and that's we are, that's what we study. We are in the same stage, like everyone. So we, as a PharmD graduates, our role is to uh, care for patients in terms of medicines. So that's what we study, and that's what we are here for. Yeah.
Thank you, sir. Sir, if any one of us wish to join the center, what's the process? How can we do that?
Yes. Thanks, Aishi. That's a nice question. And you know what? Yes. At present, as I said before, we are doing some backend process. As it is 3 years old now, and now we just want to make sure we have a good foundation. So that's why we took 3 years time. So now we we got good publicity, like, among the patient, among the public. Uh, how we are going to, like, not going to treat or give service for them in terms of medication review or whatever things like that. We do, and now patients or people got a good awareness, and in few months or so, like, we are still, like, figuring out how we can make the things, and once it is done, we will definitely going to advertise in a huge thing, like, and that day is not so far, and but when it comes, and definitely, I will let you guys know, like, RX doctors, now it's a good platform. So, like, huge number of students are there here, and it's a good platform to know, and we will be, like, also, like, few conferences also. Few colleges have called for us for conferences, in person, to give a conference there. So by all this means, students also will get a good awareness of this particular thing, medication opinion center. And once all set, we will definitely advertise in RX doctors and other platforms too, where the students are there. Like, and once it is there, and it's definitely open. Like, yeah, and we will take it to the next level. Like, it's not only me, and we all we need students like you. Yeah.
Yes, sir. So, one question I got is, what is the future plan for this center? Like, in next 5 years, where do you see this platform?
Yeah, I think I have answered that a long way, but I will brief that too. In next 5 years, like as we said, it took like 3 years to get a proper recognition and awareness among the public. From now on, it will be quite easy. Like in the next 5 years, or maybe 5 to 10 years, like it's like just wanted to expand these things, like all over Tamil Nadu, or maybe if possible in India. Like, yeah, at first, it's not, it will be a big goal, but first, step by steps first. We have a small center, like, in Tamil Nadu, Chennai. Now we need to work on that. If at least like, 10,000 or at least like 5,000 to 10,000 people, like, that will be, if you change one family, and that's a kind of snowball effect. I think you might know about this thing term called snowball effect. So one people know, it's like word of mouth, like, and they, if we do a good service, and that will be the through word of mouth it will spread, and that will become a snowball effect. And end of the day, we'll get like more and more like the service which you do. It's the same as GP. If you go to a general Christian, like if you get a good service from him or her, you're definitely going to um, revisit that particular GP, right? And eventually the doctor will become your family doctor too. So that's the thing. If you're doing a right service and they're happy, so that's what it is going to happen. Like, yeah, so that's what we see in next 5 years or 10 years. Like, yeah, to expand and at first to give a good service for this, for this one company what we have now. Yeah, the one branch.
That is a
Where is your
wonderful
center
thought, sir.
particularly located? In Chennai?
Sorry. Yeah, it's in Chennai.
Where it particularly located in Chennai?
Chennai, it's in Avadi,
Okay.
AVADI. Yeah.
Okay.
Thanks, Prem. Is there any other questions, Aishi?
I think that's all the questions, sir.
Yeah.
Thank you so much, Dr. S. Manoj, sir, for that inspiring and insightful session. Your vision for patient centric healthcare and the work being done through the Medication Opinion Center has given us a new perspective on how compassion and clinical excellence can go hand in hand. We truly appreciate the passion and dedication you have shared with us today, sir. Thank you so much.
Thanks very much for your kind invitation for this particular conference. And I wish all the students who are present over here to be, to graduate in a good terms, and to come through in a flying colors. And thanks very much for this opportunity. Thank you.
Thank you so much, sir. And with that, we conclude another enriching day at SYCCON. On behalf of the organizing team, I extend a heartfelt thanks to our esteemed speakers, Dr. Akhil Arun sir, Dr. S. Srinivas Nayak sir, and Dr. S. Manoj Kumar sir, for sharing their expertise, insight, and practical experience with us this evening. Today's session not only deepened our understanding of geriatric clinical pharmacy and patient centric care, but also reminded us of the importance of evidence based practice, continuous learning, and compassionate healthcare delivery. A big thank you to all our participants for your active engagement, thoughtful questions, and commitment to growing as a future leaders in the pharmacy profession. We look forward to seeing you again for day 16, where more inspiring sessions and discussion await. Until then, stay curious, keep learning, and continue making a positive difference in the patient care. Before we bid goodbyes, There is a feedback link shared in the chat box. Make sure you fill that form before you leave the meeting. The link is shared in the chat box. Guys, let's make sure that we fill the feedback form. Thank you, all of you, for participating. Good night, and thank you again.